In a bustling city in Africa, a young woman named Aisha found herself bedridden with a high fever and persistent cough. Desperate for relief, she visited a local pharmacy where she purchased what she believed to be antibiotics to treat her symptoms. Unknown to her, the medication she bought was a counterfeit drug, lacking the necessary active ingredients to combat her illness. As days passed, Aisha's condition worsened and she began experiencing severe side effects from the fake medication. On a particular night, she started losing her breath. She managed to crawl out of her house to seek help from her neighbors. On getting outside, she started knocking on her neighbor's door so that they could get her to the nearest hospital. Her neighbors were inside their house and were preparing to sleep when they heard the knock on their door. "Who is at the door?" Musa asked. "Who is at the door?" Musa asked again, but Aisha was too weak to respond. On the floor outside, Aisha was praying for a divine intervention, that her neighbor would open the gates to take her to the hospital. Musa and his family were scared, thinking, who could be knocking, refusing to tell us his or her name? Or could it be a thief that is trying to lure us out in order to rob us? At some point, Musa braced up, took a stick in his hand, and told his wife to come behind him with a stick so that together they can deal with the person knocking. When Musa and his wife got outside, they saw Aisha lying helplessly on the floor, almost lifeless. All she could do was to use her hand to demonstrate that she needed a quick help to the hospital. When they got to the nearby clinic, the healthcare workers quickly realized the gravity of the situation. Aisha was diagnosed with a drug-resistant strain of pneumonia, with a direct result of the ineffective treatment she had been taking. The healthcare workers explained to Aisha and her family the dangers of counterfeit medications, emphasizing the importance of purchasing drugs from reputable sources. They shared stories of other patients who had suffered similar fate due to fake drugs, highlighting the devastating impact they can have on individuals and communities. Aisha's recovery was slow and arduous, requiring intensive care and specialized treatment to combat the drug-resistant infection. The experience left her shaken and weary of seeking medical help in the future, fearing the consequences of unknowingly consuming counterfeit medications.